Hello, good evening, and welcome to this conversation. We were asked to address the issue relating to a very specific type of, vaginal discharge. And we were asked the question, Doctor, what causes people to have a fishy smell or a fishy vaginal discharge? As usual, welcome. Tell us where you're coming from or where you're watching us from, and tag somebody, invite somebody. Farai Mutanga, good to see you, so that we can, spread the knowledge. So now, because there are, of course, the fishy smell, in terms of the fishy smelling discharge, has a specific cause. But again, to limit this conversation just to that may leave you with other questions. So we are also going to address the other type of discharge. It may not be fishy in terms of its smell, but it's also foul smelling, like the fishy one. And I thought that we discuss both of them very quickly, and then we go straight to answer your questions. So we will take about 20 minutes to discuss these conditions, and then we go into the questions that you've put on the platform. We hope we'll be able to do this within the hour. We may not be able to answer most of your questions, but as many as possible, we will answer them. Now, let's begin from here, and I'm hoping that men are also here, because sometimes these things, as men, we don't understand them so well, and as a result, we come to the wrong conclusions sometimes, and we cause problems for ladies, because probably we do not understand certain things. And I'm hoping that some men are here, so that we can also, they can also get to appreciate these things. The other group I'm hoping are here are also, younger ladies who don't have access to either an older sister or an aunt who can help them understand these things. So to begin with, let's start by telling you that a vaginal discharge is normal. Okay? For men, you need to understand that it is normal and expected that someone is going to have a vaginal discharge. And the reason there is a vaginal discharge is because that's the natural way with which the vaginal tract keeps itself clean and takes care of itself. And for ladies, understand this. The vaginal tract does not need your help to maintain itself. It's a self-contained system that is able to look after itself. And I'll explain as we go, then probably we'll be on the same page. There are things that some ladies do that put them at risk because they think that the vaginal tract needs their help to look after itself or to stay clean or things like that. It actually doesn't need too much maintenance, as some of you have come to attest. So within the vaginal tract, I need you to understand that within the vaginal tract, there are organisms there. You have bacteria, different types of bacteria, both good and bad bacteria. They live together in the vaginal tract, including fungus. They live together in there. And they are in there to maintain the health status of the vaginal tract. And then you also have other glands that produce juices and mucus and other juices in there to maintain the health of the vaginal tract and also to maintain the pH. Now, sometimes you will find that the balance between the good bacteria and the bad bacteria can be tilted, whereby, you see, you have the type of bacteria called lactobacilli that sits in the vagina. That type of bacteria is actually very good for you. Its job is to police. You find that the lactobacilli keeps the fungus in check. As long as you have lactobacilli in there, which is a bacteria, it will keep the fungus from overgrowing. It will also keep the other types of bacteria which can cause problems for you also from overgrowing. As we go, we explain. So you will find that the natural environment of the vaginal tract can change from time to time. Ladies, you have noticed that sometimes you will find that the vaginal tract, the discharge may change either in texture or volume or even color towards the end of your periods. You will notice that you get a whitish discharge, a lot of fungus, but that is self-limiting and it's expected. We discussed that in the other video. If you missed it, please check it. You will also notice that towards your ovulation or as you are ovulating, the discharge also becomes a bit more and it's of a certain characteristic and it's normal. So generally speaking, a vaginal discharge is commonly normal. Okay? When women are breastfeeding or when they are pregnant, these things happen and they change. So understand this, that generally speaking, a vaginal discharge is expected and it is normal. However, you will find that even the smell changes from time to time. But then also be very careful when you are addressing these issues. You will find that if you don't mind your personal hygiene properly, the vaginal discharge also tends to be of a very unpleasant smell. So that can also happen. But generally speaking, not every unpleasant smell from the vaginal discharge connotes an infection. Sometimes it could just be, personal hygiene. And when it comes to personal hygiene, just use ordinary water. Okay? Just use ordinary clean water. Don't go inside with all kinds of concoctions that I hear nowadays. I'm told nowadays people even do steaming. They put steam in there. Why you put steam, I don't know. But I'm told it's now a common practice. It's really unnecessary, okay, to put steam. And I'll explain as we go. So, now, if a vaginal discharge is normal, and vaginal discharge can be of different colors, can be of different smells, when does it become a problem? When do you say that, okay, this particular vaginal discharge could be a problem and I need to go and see a doctor? Or I need to go and have it checked? It is when your vaginal discharge is not what you usually experience and see yourself. Ladies, you know what I'm talking about. Okay? It's when, for example, the color has changed. The discharge is gray in color. Or it has changed to green. Or it has changed to yellow. Then there's an issue there. Especially when the color has changed and it's associated with itching, a burning sensation when passing urine, then you know you're in trouble. Then that is not normal. Okay? That is not okay. And on top of that, it's also foul smelling. Then you know that this is outside what is normal. Now, let's go to the things that may cause problems with regards to the balance in the vaginal tract and can lead to abnormal discharges. It could be that as a woman you're on antibiotics for any reason. Ladies, you've noticed that when you're on antibiotics for any other cause, it may cause changes in your discharge because those antibiotics, they may not select. Maybe you could be on antibiotics for a pneumonia, or you could be on antibiotics for a sore throat. They will not select. They may also kill the good bacteria in the vaginal tract, especially lactobacilli. And if that happens, you may have a problem with the bad bacteria overgrowing and then having a bad discharge, which is also foul smelling. Also, sometimes when you're on steroids, that can also happen. The other reason is that you may have what we call bacterial vaginosis. I will come back to this particular one because it's part of the conversation we're having today. Okay, I'll come back to this one. Okay, and also when you're on birth control pills, you've noticed, ladies, that when you are on certain types of hormonal contraceptives, because they change the environment, particularly if you have you're on a hormonal contraceptive that increases the levels of estrogen, you'll find that the discharge may also be more, particularly the discharge relating to fungus. It may be very white and itchy and cause a lot of discomfort. Cervical cancer also gives you a discharge. It's also foul smelling, but the difference is that with cervical cancer, eventually the discharge usually is somewhat brownish, can also have blood in it. Okay. Other sexually transmitted diseases like gonorrhea can give you a discharge. In fact, typically gonorrhea will give you a yellowish discharge. It may also be whitish, but usually leaning towards yellow. Yeah, so it may give you that. If your diabetes is not well controlled, it may also disturb the capacity of your vaginal tract to maintain itself. You may end up with a discharge. Is it douching or douching or douching that you ladies like to do? If you're using scented soaps and you really want to clean inside, I don't know why. And I don't know who started this notion where ladies now feel the need to really go inside and really clean, like putting soaps and everything, including steam. It's very unnecessary. It actually creates an environment for bad discharges to start coming. If you have a pelvic inflammatory disease, or if you had surgery around your pelvis, another very important condition we will discuss just in a minute is trichomoniasis. Okay, trichomoniasis. We'll discuss that. You could also have a yeast infection, or you could have a vaginitis or irritation that can cause that. So these are some of the possible environments or situations where you will find that you are having an abnormal discharge. Okay? That the discharge has become abnormal. So when you see that you have an abnormal discharge, those are some of the things we will look for. Now let's go to this specific type of discharge which comes with a fishy smell. Now, this particular type which comes with a fishy smell, and it can be of different colors. It can be gray in color, it can be green, it can be yellow, and it has a foul smell. It smells like rotten fish. Okay? Now, this type of discharge is caused because of a condition we call bacterial vaginosis. Now, with bacterial vaginosis, I need you to understand that bacterial vaginosis, you could argue that it's not really an infection because it is the bacteria that you already have in the vaginal tract which has overgrown. And it is usually the bad one. Remember I said in the vaginal tract, you have organisms in there that maintain the environment. You have good bacteria like lactobacilli, and then you have other types of bacteria, especially anaerobic bacteria that are also in the same environment. Now, if you have something that has affected the lactobacilli, such that the bad bacteria begins to overgrow, you end up with what we call bacterial vaginosis. And bacterial vaginosis is characteristic because it has a foul smell, and the color could be gray, could be green, could be yellow, it could be any other color, but characteristically it smells like rotten fish. And it comes with itching, so you can be scratching as well, you can be itching, and also there'll be redness in your privates. It's very, very unpleasant. Okay. Now, others are asking, so what causes that? What causes bacterial vaginosis? Now, the mechanism that causes that, we don't yet have a good theory in science to explain it, but there are circumstances that can lead to that. Bacterial vaginosis is very common in women who have multiple sexual partners. So if you're a woman and you're having multiple sexual partners who are not even using condoms, you will have or you will trigger bacterial vaginosis. It is also found in women who not necessarily have multiple sexual partners, but when you have changed sexual partners, okay? when you change sexual partners and there is no use of condoms and you just change from one sexual partner to another, don't be surprised if you experience bacterial vaginosis. It's actually expected. All right? Don't be surprised. It's actually expected that, you could have that. So a change in sexual partner or having a new sexual partner, it can trigger the bacterial vaginosis. The other thing that can trigger bacterial vaginosis is douching or douching, those things, where people use strong detergents to go and clean out the vaginal tract, and in the process, they disturb the environment. Okay? You disturb the environment. Some people go, I'm told nowadays they put steam. That steam you are putting, it can also disturb the environment. And when the environment is disturbed and the good bacteria is overwhelmed, you end up with the bacterial vaginosis. All right? That's another cause. So not every person you find with bacterial vaginosis has had multiple sexual partners, but you really need to check, because multiple sexual partners, especially if sexual partners are not using condoms, it's the commonest cause. But again, you need to be careful. If women are, if the lady is doing douching or doshing or putting steam in there, that also can cause a bit of a challenge. The other issue is that they may not be doshing, or they may not even putting detergents in there. The woman may not even be having multiple sexual partners. It has not even changed sexual partners. It's just that this lady naturally has very low lactobacilli in her system. And these are ladies who, no matter what they do, they'll always wake up with that fishy smell. Why? Because naturally this lady has very low lactobacilli in her vaginal tract. And as a result, she's vulnerable to this foul-smelling fishy smell that is there. So, ladies, when you notice these things, like I've said, a discharge is expected under different circumstances. But if you notice this specific type of discharge, see your doctor and let them investigate. And I need you to understand that not every bacterial vaginosis is because of multiple sexual partners. And this goes to the men who are watching this. Like I've explained, sometimes it could be that she has very little lactobacilli. Or it could be that you are the new sexual partner that she has. Remember that a new sexual partner can trigger the same problem. Okay? But also, it doesn't take away the fact that multiple sexual partners can lead to bacterial vaginosis. So prevention, basically in this situation, prevention is about making sure that you use condoms, avoid things like steaming, douching or douching that people do. Avoid those things, okay? Avoid such things, all right? And also just pay attention. When you're on antibiotics, it may also happen that you could have the problem. So now, why are we discussing this? The reason we are discussing this is because when you allow this thing to stay, for example, if you are pregnant, these are things that cause premature delivery. You have a preterm baby, an immature baby is born because of such things. So that's why we pay attention to such things. One of the other complications has to do with the fact that it can easily complicate into pelvic inflammatory disease, where the infection or the bad bacteria can go up into the uterus all the way to the tubes and affect the tubes. And when the tubes are affected, and if it's not properly handled, those tubes can get blocked and you may not have children again. Okay, so just bear such things in mind. Okay, so minimize vaginal irritation. Don't do this douching that people do. And as much as possible, if you're having a new partner, or if you're one who is prone to having multiple sexual partners, use condoms. Okay? Use condoms. Now, the other infection that you will find, similar to bacterial vaginosis, except that this one, it is sexually transmitted. It doesn't have all these other things. Like, bacterial vaginosis, I've told you there's several situations where you can have it. And to diagnose bacterial vaginosis, they'll take a swab, take it to the lab and check. They'll find that the bad bacteria has outgrown the good one. Now, there's another infection. It's caused by a parasite. In men, this particular parasite does not really have symptoms. Once in a while, a man can have itching when they are passing urine, but in women, it gives problems. Okay? It's called trichomoniasis. Now, trichomoniasis is caused by a parasite. Now, it's a pity that some of you are scared of these images. I was going to actually show you the image, but I learned my lesson. The last time I showed you the image of mites, others could not sleep. So I'm not going to show you this one because some of you may not sleep and it's at night. So I'm not going to show that image. But trichomoniasis is a sexually transmitted infection. Now with trichomoniasis, it also causes a foul-smelling discharge. And typical of this particular discharge, it's frothy. Even like soap, it looks like soapy water like this. It's frothy. It's frothy like the way, when you're brushing your teeth with your toothpaste, that froth, or the froth of your detergent when it's in water, it looks like that. And it's a parasite. And the color can also be whitish, but it's frothy. The way you distinguish it is that, for example, if it's a fungal infection, you know that the fungal infection of Candida will give you a whitish, thick, whitish, cheesy sort of discharge. But if it's trichomoniasis, it can also be white, except that it's frothy. And it's foul-smelling. It can also be green in color. It can also be yellow. And it can also be gray, but it's frothy. And this one is sexually transmitted. It's an STD. It can also affect men, except that in men, the symptoms are not that bad. Okay? Now, in addition to the frothy smell, the frothy discharge, which is also foul-smelling, is that there's itching as well. And there's a burning sensation as well. And when you really look, the privates look swollen. All right? And then you will notice that with this one, the women will also complain about painful urination. When passing urine, it's painful. Or with this particular one, they may also complain of painful intercourse. Okay. Then you know that this is the trichomoniasis. But then, that's just a clinical suspicion. To confirm it, you have to take a sample to the lab. They can check your urine as well. They can take a swab from the vaginal tract, take it to the lab, and they'll be looking for this very organism. It swims. It even has hair. It swims around like this. And that's what the lab will be looking for. When they see it, then that's the diagnosis. They'll put you on medication for it. And if they don't, they may check your blood and look for specific antigens against it. All right. So basically, with this particular one, risk factors include multiple sexual partners. Okay, especially if you have multiple sexual partners that are not using protection or condoms, you are at risk of trichomoniasis. All right. The other issue is that if you've had the other risk factors, if you've had it before in the past, chances of having it again are high. So previous episodes of trichomoniasis can also, and also having sex with multiple partners without condoms is an issue. Complications are very similar to bacterial vaginosis, where if this thing is not well treated and it's not properly identified, in a pregnant woman it may cause premature birth or preterm birth. Okay, and babies who are born with low birth weight and things like that. All right. Okay. And the other thing is that as the baby is being born, note that trichomoniasis can be passed on to the baby. So just be careful. Prevention, like I have said, avoid multiple sexual partners. If you should, have multiple sexual partners, use condoms. Otherwise, these are infections that when they sit in, they also potentiate other problems that end up affecting the tubes. So when the tubes are affected, they may get closed and you may not have babies again. All right? Having said that, let's look at the questions you have for us today. Let me see. Right, so now let's go to the questions you sent. Namatama Chamasonde, your question was, does hormonal imbalance cause prolonged periods? Yes, it does. It can cause both, either prolonged periods or periods that are not very prolonged at all. Sometimes it may cause periods not to come at all. So either way, sometimes hormonal imbalance can cause you not to have your periods on time. Sometimes it may cause you to have very heavy prolonged periods. So be very careful. However, be very careful with words like hormonal imbalance, because the issue is that there are several types of hormones that can go out of balance. So be very careful. So if you suspect that you have such a problem, see your doctor. Sarah Nkosi, your question is, doctor, can diabetes affect someone's fertility? Yes, it can, particularly in men. It can cause someone's fertility to be affected, particularly in men. Now, be very careful when you're using words like can diabetes cause someone to be infertile. The issue here is not that diabetes is the problem. It is when the diabetes is not controlled. Remember that when diabetes is well controlled, you may avoid all these problems. The other question is, doctor, this is from Peter. Can toilet seats transmit STIs or UTI? No. Toilet seats have not been shown to transmit UTIs in women. Although you might want to be careful how you sit on those, especially public toilets. Just be careful for other hygienic reasons. But to expect that a toilet seat to give you a UTI is very unlikely. Very unlikely. I'm not saying it's impossible, but a UTI on a toilet seat is unlikely. But still be very careful how you sit on public toilets. Okay? Just be careful. Because you could get other skin infections and things like that, And remember that when you're sitting on the toilet seat, you are exposing your very intimate, structures. So just be very careful. Okay. Felicity Martha Simalonga. Doctor, what causes a low HB? Okay, so a low HB or a low hemoglobin can be caused by loss of blood. For example, if you are bleeding and you don't know that you're bleeding. Okay. For example, you could be bleeding and you're not aware. So loss of blood. The commonest causes of loss of blood in women have to do with fibroids. So women who have fibroids, and those fibroids are causing prolonged bleeding, and prolonged bleeding can lead to a low HB. Another cause for prolonged bleeding in women is during pregnancy or when you're delivering. So you've just had a baby and you bled a lot during your delivery. It's called PPH. It can cause that. You could have a cancer and you're not aware. For example, if you have cervical cancer and it has advanced and you're not aware, it tends to bleed a lot. You could have a cancer in your rectum and you're not aware, you tend to bleed. So, causes of a low HB, number one, loss of blood. And loss of blood is bleeding. Another problem is nutritional deficiencies. Remember that for your body to produce blood, it needs raw materials. And if you're not giving your body enough raw materials to produce blood, it will not produce blood, and therefore you have a low HB. Another problem is that if your bone marrow itself, okay, you are giving it raw materials, but the bone marrow itself, because that's where blood is produced, and there's a problem there and your bone marrow is not able to sustain the production, you end up with this particular problem. Okay. Next question. Now, this question is from, I can't pronounce your name, but your question is saying, okay, your surname is Sivagnoni. I can't pronounce Kanyisile Sivagnoni. Your question is, doctor, what causes a whitish hard pimple around the labia majora? What are they called and are they curable? Now, what you're referring to as a large pimple around the labia majora, my guess is that you are probably referring to a Bartholin's cyst. That's my guess. Now, a Bartholin's cyst, it can present as a large pimple, okay, around the labia. And it is because there's the Bartholin's gland, there's a gland called Bartholin's gland, that's its name. Now, that particular gland, its job is to produce the juices that maintain the health of the vaginal tract. Okay? So remember, we're talking about discharge a few minutes ago, and we said that a lot of the discharge that you find is actually normal. It's actually expected. And the Bartholin's gland is one of those glands that is responsible for production of the juices that maintain the health of the vaginal tract. That's why I said the vaginal tract does not need too much help from you to maintain itself. It actually does a good job on its own because it produces enough to cleanse itself. Now, that particular gland, when it's producing juices, it's got a tube that pushes out the juice into the vaginal tract. It's called the Bartholin's duct. Now, when that duct is blocked, it can be blocked by infection, it can be blocked by thick mucus, it can be blocked by anything. When that tube is blocked, the Bartholin's cyst does not know that the tube is blocked. So it will continue producing the juice. And because it is blocked, it begins to swell. And as it is swelling, this is what you end up with, what you're calling a large pimple around the labia majora. So a Bartholin's cyst, it's generally painless in the beginning, but as it grows bigger, or if it gets infected, you end up with what we call a Bartholin's abscess, ichipute. And when it gets infected, it becomes extremely painful. So these are things that you go and sit down with your gynecologist. They are better at dealing with this problem. I can only explain it rough for you here. But you need to see a gynecologist. They are very good at dealing with these issues. So your gynecologist will sit down with you and look at the situation. Sometimes what they do with the Bartholin's cyst is that they can aspirate. They get a needle and a syringe and pump out and let you go home. And sometimes that can be a solution. But if that fails, what they may do is that they will do surgery. Okay, it doesn't require to go into theater. Sometimes it's a doctor's office procedure. They will do, surgery on it. They'll just flip the gland, flip it on itself, and suture it, and it will never give you problems again. But some experts argue that if you are going to treat a Bartholin's cyst like that, then the lady must get all her underwear, go and burn them, and buy a new set. Okay? Once the Bartholin's cyst has been treated, they've done surgery on you and whatever, some experts argue that they will actually advise you to go home and get all your underwear, go and burn them, and buy a new set. But that is after the doctor has intervened and they've treated the Bartholin's cyst. Natasha Kasonde Chimponda. Your question is, Doctor, I am having heartburns almost every other day. What could be wrong and how can I have them treated? Now, we discussed heartburn, I think last week or the other week. So heartburn, okay, or what you call gastroesophageal reflux disease or GERD, is because the acid in your stomach is coming backwards into your food pipe. And as it gets into your food pipe, it gives you heartburn. And it may also give you central chest pain. Now, for this, you will find that sometimes it's because you have colonization of your stomach by a special bacteria called Helicobacter pylori. And that bacteria needs to be treated. And you may also be put on antacids to just, for symptom relief. But what people suggest is that should you continue to have, because usually these things, sometimes they go away on their own. Sometimes they go away with just some antacid, even over the counter, and say antacids, these things go away. But if it persists, despite using these over-the-counter things you people like to get, you might need an endoscopy. An endoscopy is where they will push a camera through your mouth all the way to your stomach to see exactly what's wrong. Because sometimes this problem is because you have an ulcer. You have an ulcer in your stomach. Okay. Okay. Someone here wants us to talk about bedroom suites. Okay. These products people call bedroom suites. We've seen them. I've seen them myself. I've literally touched them. They come in different colors. I've not tried them, but I've seen them. And I'm told these bedroom suites, for some people, they use them to warm themselves and make themselves ready. Others, I'm told, they use some of these things to tighten themselves. But let's address this. Okay? It's a paradox that on the one hand, you have men pursuing a large penis, and they do all kinds of things to get a big one. And on the other hand, you have ladies pursuing a tighter vaginal tract. I think men and women, you need to talk to each other because you are going in opposite directions. Okay? Others are tightening and your other partners are enlarging. What's the point here? What are we doing? So, I think that you need to have a conference as partners and work together. What I always tell gentlemen in our private conversations is that, the pursuit for a large manhood is a very useless pursuit. Here's why. Because the vaginal tract is very elastic. No matter how big you get, you will still be accommodated. How do you think the baby comes out? And have you ever looked at the size of the head of a baby? Is that the size you're pursuing? So, really, it's more of a psychological problem. Ladies also, if it's about tightening and you really want to tighten yourselves, you see, most concoctions you're going to use for tightening, do you know how they work? They actually cause swelling inside. Nikuvimba. You swell. It's not really a real tightening because at the end of the day, if it's really tightening that actually happens, why do you have to drink it over and over again? Because see, you swell, you cause swelling, and the swelling goes down. You go back to what you were. That's why there's these sunko things people like doing. The same thing of, these bedroom suites you like doing. Be very careful. Because some of these things, they disturb the vaginal tract. That's why I find that a lot of experts or a lot of doctors, including your gynecologists, they are very skeptical about these methods that you like using. Some of you have put yourselves at risk. Serious risk. Okay? So just be very careful with what you're using. Ask questions. Especially if someone has brought you these things. Especially if somebody has brought you and the person who is selling them to you, let them explain to you how these things work. Okay? Don't come and ask me because I'm not the one who's supplying them. I'm not the supplier for bedroom suites and sunko. I'm not the supplier. So what you do, ladies, is that if somebody is supplying you these things, ask them questions. Let them tell you exactly how these things work. What's the mechanism? Because anything a human being gives you, a drug or anything, it must have a mechanism. And what's the mechanism? And then after they tell you the mechanism, tell the supplier also to tell you what are the side effects. Okay? Because we excuse these people too much because, you know, we really make each other feel very insecure. You have men going to enlarge and putting pressure on the women to tighten. And in the process, the two sides are not talking to each other. And as a result, you create problems. Talk to each other then. Maybe we need a conference for women and ladies. The conference so that we can agree. Because otherwise, why are you going in opposite directions? Okay. Sally Muleya, the question is, what causes some girls to be smelly down there and how? Okay, we've discussed this. I think we touched this question. We're not going to go back to it. Maybe you came a bit late, so we addressed this question. Rachel, your question is, what is the treatment for, and is there a cure for vitiligo? No, there's no cure for vitiligo. In fact, the argument some people have about vitiligo is that it's one of those very few conditions or situations where some of your dermatologists may actually prescribe skin lightening creams. Like bleach your skin. They may prescribe that you bleach your skin just to create a consistency. Yeah. So, but really in terms of a cure to reverse the vitiligo, there's no cure for that. Now, vitiligo, this is where somebody's skin begins to change from a black person to a white person. Or from a black person's skin to a white person's skin. And the reason that happens is because, remember we discussed autoimmune diseases. Your own immune system begins to attack the cells that produce melanin, which is the color that you have of your skin. Like a black person like me, I produce melanin under my skin. And then what ends up happening is that my own immune system begins to attack the cells that produce the black tone that I have. And cells stop producing that. And then because of that, you find that my skin begins to turn into white. A very famous musician who's died had that condition. Michael Jackson. He had vitiligo as well. So what some people will do, because vitiligo sometimes can make you self-conscious, you know, there's also bullying. People are generally not nice to things that are different from them. Okay? I mean, if you have something different on your body, generally people tend to bully you. And so you'll find that people have vitiligo, they're self-conscious. Some have even committed suicide because society sometimes can be mean. People can be harsh. Yeah. But otherwise, a person who has vitiligo, they are very normal. It's just a skin pigment, which is, you know, which has been affected by an autoimmune disease. And there's no cure for it. Okay? It's not painful. Except that sometimes people have vitiligo also, they may have another underlying autoimmune disease like diabetes or lupus or other things. So that's another thing we check for. If someone has vitiligo, we also look for other, you know, autoimmune diseases in addition to what they have. But otherwise, the skin changes in vitiligo have no cure. Next question. Okay, that question we've answered it. There's another question relating to vaginal discharge. I think we've discussed that earlier on. So please just rewind this video when we're done and then look at it. What is it? Okay, yeah. So Mercy Mercy, your question is, Doc, what causes itching all over the body without a rash? I'm sure, Mercy, you will notice that the itching comes after you have finished bathing, and then your skin is dry. And usually that's what people experience. And the reason you have the itching is because your skin is too dry. And because of that, it cracks and then you start to itch. Yeah. Yes, of course. I don't have information on bedroom suites. I'm not the supplier, so I don't know how it works. I've never studied those things, but I know that a lot of you like them. So I also want to learn from the suppliers. You can also get us information from your supplier of bedroom suites, and then we also come and learn together here. But for me, because I don't know how those things work, I'd actually be quick to discourage you from using them. I don't even know what they do, these bedroom suites. So if you are here and you know how bedroom suites work, tell us. Tell me, what do they do? Those of you who have used bedroom suites, while we are here, tell us, what do they do for you? Then maybe I can explain. What effects do they have? Don't feel shy. Just type here, I'll read. Please don't mention tightening, because if that's what they do, just stop. They're just creating problems for yourself. Right. Tos J. Raj, your question is, Doctor, what causes vaginal dryness? Okay, what causes vaginal dryness? One of the things that we don't talk about a lot, and I'm hoping that maybe at some point we should bring an expert here to come and talk to us. This is the problem of sexual dysfunction in women. Usually, it's very easy and common, even on this page. We like to talk about erectile dysfunction, premature ejaculation. Basically, sexual dysfunction in men, it's commonly discussed. But sexual dysfunction in women is not discussed. And I think this is the question which is being asked here. For example, she's asking, what causes vaginal dryness? It's a component of sexual dysfunction in women, except that it's not discussed that much. And as a result, a lot of women suffer with these things, and they don't even come out. Okay? They don't come to the doctors. They don't even discuss it with their partners. Because you see, vaginal dryness, one of the biggest problems it causes is very, very painful intercourse. Very painful and very unpleasant intercourse. Yeah? So what we would do is that I think we should bring an expert on this one. I'll organize some experts to come and talk to us about the issue of sexual dysfunction in women, so that even I can learn together with you on the same subject. All right? So we'll skip this question for another day. How much time do we have? We have 5 minutes left. And in the next 5 minutes, I'll answer a few questions, then we can call it a wrap. There's a game coming up in the next, there's football coming up in the next 20 minutes. I also need to go and watch football. So let me take the last questions and see. Which would be the last question here? What causes ringworms? Okay, this is a fungal infection of your skin. So that shouldn't be a very big problem. You just need some antifungal creams. Well, what causes PID? This is pelvic inflammatory disease. We touched on this when we were talking about the vaginal discharges and the complications that can arise from those STIs and things like that. Okay. Doc, what causes alopecia and how can it be treated? Alopecia, which is hair loss. You have alopecia areata, which is also, hair loss. And alopecia can be due to hormonal changes. Okay. It can also be an autoimmune disorder where your own immune system is eating away your hair follicles. It can be due to that. But again, like all other things, if you're having alopecia, it's very important that you sit with your dermatologist. This is a problem for the dermatologist, the skin doctor. And they are supposed to sort this out for you. Now, in advanced places, they also do what we call hair transplant. If everything else has become a problem, they do hair transplant. All right. In Zambia, we're not yet there yet. We don't do hair transplant yet. But in different parts of the world now, hair transplant is the in thing for alopecia. Especially for male pattern baldness like me. See? Maybe I should take myself for a hair transplant. Who knows? But then, there are some natural remedies that others have used that also help with to regrow your hair. I've seen some of the very natural remedies. They use literally food that you eat every day to produce hair growth concoctions. Some of them actually work. Huh? I've seen some of them work with very good results. So there are some people who produce these things, and yeah, I've seen these things work. So if you have alopecia and try some of these homemade remedies that others are using. I've seen some, and I've seen them work. Try them, and because they use food to create them and they are organic, they shouldn't give you complications. Try that before you come to us and we start putting chemicals on you. Try that. What's the time now? Okay, we have 3 minutes to go. Let me see. Last question. Okay, we've answered that. Last question. Okay, this one is a very technical question, but let's see. Joseph Lungu is asking, Doctor, what is the role of echocardiography in the diagnosis of angina? Okay, and what is the best examination for the diagnosis? Now, this is a very, very technical question. Very technical. First of all, I need to explain to you what echocardiography is. Then I need to explain to you what angina is. Okay, very quickly. Echocardiography is, when you go for ultrasound, the ultrasound you go for the baby. Echocardiography is basically ultrasound for the heart. It's very technical. And angina, basically, it is pain in the heart that is caused because a portion of the heart has been starved of oxygen. Now, the question is asking me here is that, is an ultrasound for the heart the best way to see whether the portion of the heart is being starved of oxygen? And the answer is yes, there's a role for that particular procedure. There's a role for it. Okay, you can't proceed. There's a role for it. Okay, but you still need to do what we call an electrical study of the heart by doing an ECG. Because angina could be a sign that you are having what you call a myocardial infarction. Now, myocardial infarction, this is where the muscle of the heart has actually begun to die because of lack of oxygen. And sometimes angina could be because the rhythm of the heart has been disturbed such that the blood flow to the heart muscle is being compromised. Why? Because the heart is out of sync. Because that can happen. The synchronization of the heart has been disturbed. And because that synchronization has been disturbed, one of the ways you can tell that the synchronization has been disturbed, you have to do what we call an ECG. So to ask what is the best examination for the diagnosis of angina, I would say you need to do both an ECG, okay? You also need to do an echo as well, all right? But if nothing really does that, then you need the help of an interventional cardiologist. They will go and put you on a big machine, which is able now to go and look at the blood vessels themselves of the heart and see whether there's a blockage or not. Now you see. That's why I told you that this question is very technical. All right, ladies and gentlemen, it's time to go and watch football. It was a pleasure interacting with you, and I hope you've learned one or two things. And as usual, like we keep asking you, please share this video. And ladies and gentlemen, if you or your partner has any of these issues that we've raised, see a doctor near you. If you cannot, you can come see us, but we would tell you to see your regular doctor, your usual doctor, or any doctor near you. Don't let these things stick around unnecessarily long. There's no reason for you to continue suffering when you can actually do something about these things. All right? That said, this has been Dr. Mujajati for healthy and prosperous citizens. And like I keep reminding you, ladies and gentlemen, as you go out there, wear a mask, practice social distancing, avoid crowds. If you see anybody calling crowds, don't go there. And send the same message to your loved ones and relatives. Do not go to any crowd for your own good and for your own survival. There's COVID out there, ladies and gentlemen. We are not yet out of danger. All right? Continue imposing your own personal, lockdown. Because we are not yet out of the woods. Good night and take care of yourselves. We will see you during the week. There's a chance we might bring a gynecologist on Wednesday evening. If all goes well, I will advise you what topic we're going to pose to the gynecologist, because I think that there's something that we need to discuss. One of them, we could actually bring a topic on fibroids, because a lot of you have been asking me about fibroids. So I'll bring a gynecologist to tell you about fibroids. If not, we'll discuss contraceptives. All right? So do take care, enjoy the rest of the evening, and sleep well. Good night.